Hello, everybody. Happy Wednesday. Good evening. Welcome to the Functional Medicine Solution podcast. My name is Tal. I'm the Educational Director at the American Academy of Functional Health. And with us, we have today Dr. Chill.
Hi, everybody. Welcome.
And every Wednesday, we come together, myself and Dr. Chill, for a discussion where we bring to you the best of the functional medicine, the root cause approach, and integrative herbal and nutritional medicine to help both yourself, your family to keep improving your health, and to help your patients to improve the health of your community. So, in today's episode, we have a special discussion on the topic of male sexual dysfunction. And one of the reasons why we chose this topic is because it is much more common than most of us think of. And just to run just a few of the statistics, this is a quite prevalent among adults the age of 20 and older. The statistics are, according to the American Journal of Medical Erectile Dysfunction, this topic affects over 18 million men every year in the United States. And of course, the prevalence of erectile dysfunction increases with age. But it is important to mention that it's not necessarily a normal part of aging, which is a common myth that I've heard before from patients who come in with erectile dysfunction and thinking that it is because of old age, right? So, of course, erectile dysfunction is it's a major struggle for patients who want to continuously enjoy their sexual aspect of their lives and their relationships. And we know that there's multiple factors that can contribute to it, right? That could be it's chronic diseases, for example, are a major contributor. So if you have patients with cardiovascular conditions or a history of cardiovascular or cardiometabolic conditions, we know that's one of the major contributing. Now, the second reason why we chose to talk about the root causes today of erectile dysfunction is because while there are different types of therapies that are available out there, all of them have some significant side effects. They're either very expensive, they're very temporary, or they have more serious side effects. So, in order to help those patients on a much more comprehensive with a comprehensive approach, instead of a short-term band-aid, right? We want to look into today into the 2 or 3 major factors that can lead to erectile dysfunction. And then, of course, looking into 2 or 3 natural alternatives that can help patients to not only improve their sexual function, but also improve their health. So this is it's very exciting. It's very exciting to be able to offer patients more comprehensive care and then done just the standard of care. And just to give you a general idea, this topic is very, very common. It's highly prevalent, especially if you see patients with cardiometabolic conditions. For example, among men with diabetes, some statistics are showing that about 51% of patients with diabetes, male patients with diabetes, struggle with erectile dysfunction. Right? That's about half of our patients who are struggling with diabetes. And that's just one example to show you of how prevalent it is. And we have found, and Dr. Chill, you might have had similar experience. We've had patients come in for hypertension, diabetes, neuropathy, maybe arthritis or other conditions. And as we kind of start improving their health and function and they feel better and then they don't need as much drugs and they into a few months into our sessions with them, they say, Doctor, I'm feeling this is much better. I get less swelling, less pain. I have more energy. by the way, can this approach help with erectile dysfunction? Right? Did you ever, Dr. Chill, you ever heard patients say that? Like,
That happens more often than not, and especially with our male patients. And it's because it takes a while for them to build trust in you and to feel really comfortable with exploring these aspects, and when you've started to address certain issues and they start to feel really comfortable with you, at that point they're like, okay, what about this too? And but they also might even report, because you're addressing, their cardiovascular health. They might even just tell you, has can this actually also help with erectile dysfunction? Because it seems like I'm getting better in that aspect as well. And then they'll
yeah,
go into the whole area of that.
yeah, and when we try to think about it, because I've seen very just my own personal experience or professional experience with working with patients coming in for specifically sexual dysfunction, right? Very few that came in advance and said, I'm here, my chief complaint is erectile dysfunction, right? That's just my own experience as a provider, right? Very few. But I had a lot more that came in for something else, right? And then sort of like 2 3 months 4 months into it, they were like, yeah, like, can you also help with this, right, with erectile dysfunction? So it's really interesting. It, like you said, Dr. Chill, it could be a combination of, this is a very different condition, right, than saying I got type 2 diabetes, or I got
Mhm.
hypertension, or I got arthritis, right? It's very different. There's almost this element of like shame for
Mhm.
men to admit, to say I have erectile dysfunction, right? It's
Yeah.
like this. It's a complex condition, right? Because there's some element of shame. They might be shameful to say that. Um, there's also the element of, they some of them, they don't know how to talk about this, right? They kind of feel uncomfortable with the whole, with talking about it, right? And so um so and then of course there are different types of treatments out there, and they're not a good fit for everybody, right? Or they might be too expensive. So let's talk a little bit about what options are available there for for male patients who are coming in and they struggle with erectile dysfunction. So a few of the most common ones are injections. So those are directly into the penile shaft, and these have to be injected a few minutes before intercourse. So they have to inject it every time, right? And the yearly cost of injection is quite expensive. It's reported to be about between $470 all the way to $2,000, right? So every time they inject, it costs them money. And the disadvantage are quite serious. I mean, one, there's pain every time you inject. We know that's a very sensitive organ. So to inject something into the penis, that we can just, it's a very uncomfortable thing to do every time. There's potential for bleeding, bruising, and also scar formation, right? So that's some of the side effects of that, potential side effects. A lot of patients will opt in to take pills. So there's a class of medication that is called sildenafil, which is essentially a phosphodiesterase inhibitor. And those medications treat erectile dysfunction by increasing the flow of blood into the penis during sexual stimulation. Now, those pills are quite expensive. The average patient will spend about $1,000 a year. Really, just depends on how many times they want to have intercourse. And the average that we're seeing is about $45 per pill. Now, some pills are cheaper, and then more brand name, a bigger brand name can cost even $70 per pill. The side effects include headaches, indigestion, visual changes, nasal congestion, back pain, and it could be unsafe for some patients that have cardiovascular conditions. Then we have pumps. Pumps are mechanical to, again, help to increase the flow of blood into the penis. Those can cost between $100 to $700. They're not very comfortable. And then there's rings. Some patients that I treated were trying to use rings, different pumps and rings. The rings are about $750 per year. The pumps and rings work by slowing the flow of blood out of the penis. So it's trying to keep the blood inside to keep the erection, right, harder or longer. It is uncomfortable, but a lot of patients will say it's uncomfortable, it's expensive, you lose a lot of the spontaneous spontaneity of this when you use all of these different pumps and medical devices. And then some patients will opt into surgery. That's of course a much larger procedure. It's between $15,000 to $30,000, and it does require replacement every 10 to 15 years. They have to go do the surgery again. And there's essentially a pump that is implanted in the scrotum and 2 cylinders in the penile shaft. There are a lot of risks with those surgeries: infection, scar tissue, erosion of the implant, pump or there's pump displacement, and then mechanical failures, right? So there's a lot of things that can go wrong when you put something like that in your body. And then new therapies that just came out are shockwave. Shockwave therapy are they're not very painful, from what I've been told from some patients that have tried it. They're not very painful. But you have to do several of them, typically 6 to 12. They're quite expensive. They're about $450 per session, and it's a minimum of 6 sessions. So typically these start at about $3,600, and it is not FDA approved. So for management of erectile dysfunction, so they're not covered by insurance, right? In fact, many of those treatments are not fully covered by insurance, right? So, and some of your patients might have a $5,000 or $8,000 deductible, so it won't be covered either way. They'll have to pay for 100% of those treatments. So this is where the reason we're mentioning all of this is because it's important to understand what patients are going through with their struggle to regain sexual function, right? They're spending a lot of money. The patients that I've seen that came in with erectile dysfunction were spending hundreds of dollars on supplements that they were reading online. They were spending thousands of dollars, some of them, on different pumps and pills, drugs, injections, and all of those are very temporary, right? They don't look, and that's the major problem that we have, which is instead of putting a Band-Aid on it, we would want to provide them more of a functional approach, comprehensive approach, to find out why they have erectile dysfunction. So, Dr. Chill, it's a big topic, and we know that if we can help those patients to improve their health, we provide them with a longer-term solution. We can also bring back some of that joy into their lives, right? And kind of help them to maintain those healthy relationships.
Absolutely. And it's really awesome that we as functional medicine providers can provide this service for our patients as well, because a lot of our male patients, when they come to see us, they don't think that this is a potential for them, right? They think it's only medications to help them with erectile dysfunction or sexual function. And so this is why this is kind of an important topic, because we can address these issues from a functional medicine approach. And now, with that stated, we do want to go into some of the major risk factors that are associated with erectile dysfunctions. And it's important to understand these risk factors, because you want to look at these risk factors if your patients have any of these, because these can be part of the contributing factors to your patients not being able to have sexual function proper, or proper sexual function. So let's show a image here that's popping up on the screen. This is some of the risk factors, and these are all seen in the middle here. So if you take a look at the middle of the picture, there's going to be some aspects, including physical, such as obesity, existing diseases such as diabetes, right? That's on the right-hand side. Then you go into medications such as hypertension medication. So does your patient have high blood pressure? Are they on medications for that? That can cause erectile dysfunction. Then we're looking at some neurological conditions such as Alzheimer's disease, if they've had a history of stroke. This can be preventing them from having sexual function. Then, do they have a history of surgeries? We want to take a look at that for them. And then psychological causes. Do they have anxiety, depression, a lot of stress? This is something that we want to take a look at as a part of their risk factors, so we can look at addressing some of those risk factors, maybe even preventing some of those risk factors for them. And this is all important because it's about finding the root cause of male sexual dysfunction. And it's because erectile dysfunction is a symptom caused by certain imbalances or a problem. Essentially, what we want to do is we want to look at a few factors when we're addressing this for our patients. We want to look at functional factors, right? This can be related to stress and psychological issues. We want to look at anatomic issues such as structural abnormalities. We want to take a look at neurogenic issues. Is this caused by disorders affecting the central nervous system? An example of this is dealing with some of the conditions that we were mentioning earlier, right? Multiple sclerosis is one of them. Is this vascular? Is there an issue with their circulation, right? This can be caused by conditions such as atherosclerosis, peripheral vascular disease, high blood pressure, as I was mentioning earlier, diabetes. Or is this a hormonal issue? Can it be caused by an androgen deficiency, such as testosterone deficiency, or hypothyroidism, or high prolactin levels? Or can it be a mix of all of these? Many times when you're working with these patients, it's a mix of multiple factors that are in play. That's why we really want to look at all of these different risk factors and see which ones are involved with your patient, so you can really personalize with them. The difference between functional medicine and standard of care with this approach is standard of care is usually focused on the symptoms. So then they're prescribing a medication for that. In the functional medicine approach, we're asking ourselves, what is causing this problem? And if we can find what is causing the symptoms and treat it, we can prevent further damage and help the patient really improve their health. That is really the best approach for long-term care. And this is really great because we get to see the patient continuously improve instead of just masking the symptoms with drugs or medications.
This is a really good overview of what we should look at with our patients. And if your patient comes to see you, like Dr. Chill mentioned, they have diabetic neuropathy, for example, and erectile dysfunction, then we know that we can use the functional medicine approach to address the root causes of their diabetes or neuropathy. And by improving that, we might also improve their sexual function. Some of the mechanisms that we're going to talk about today are factors that contribute not just to erectile dysfunction, but also to all of these different factors, all of these conditions that can also lead to or increase the risk of erectile dysfunction. So this was a general overview, and now we're going to get into more of a root cause approach within the functional medicine. And what I really want you to get out of this is, one, understand the functional medicine approach and the root causes that are not taught in medical school or nursing schools or PA schools, right, or pharmacy schools, and learn how to think differently when you see a patient, when you consult in a patient. And second, learn to have more natural solutions to offer your patients, because a lot of patients don't want more drugs, right? Drugs are expensive, they have side effects, right? And they don't really improve your health, right? So one, learn how to discuss with your patients about the root cause. It's a very valuable service. In our community, we found that nurses, NPs, PAs, physicians, pharmacists who are now adding functional medicine, the root cause approach, and opening their own consultation practice, they get paid between $200 to $800 per appointment. Because if you think about it, it is a very valuable service for patients when you can tell them why they're sick and give them strategies to resolve those problems. Instead of putting them on a drug, they're relying on it for the rest of their lives, right? So let's dive into factor number one, and that is inflammation. And we know that the problem with inflammation, or systemic inflammation to be more accurate, is that inflammation increases reactive oxygen species, right? Like hydrogen peroxide, other types of reactive oxygen species. Essentially, they're free radicals, right? And we know that free radicals damage the blood vessels and damage the nerves. Those are two of the major components that we must have: a healthy blood flow and blood vessels, the integrity of the blood vessels and healthy blood flow. And the nerves must function properly in order to have an erection, right? And so, unfortunately, inflammation damages all of those tissues and components all across. And there was an interesting study published in the Journal of Sexual Medicine, and the authors reviewed about 2,331 men over the age of 20, and they found that individuals who had erectile dysfunction had higher markers of systemic inflammation. So there is an association there that was found in several studies. And to better understand this, let's take a look at a picture from the Journal of Signal Transduction and Targeted Therapy. So you can see here, this is a simplified pathway it's what we call inflammaging, right? At the molecular, cellular, and organ levels. So you can see on the left side, we got a young individual, and on the right, a healthy individual. On the right side, we got an aged or an unhealthy individual. And we can see the bone marrow on the top. And essentially, what we can see here is the progression and the development of cells from the bone marrow into senescent cells, right? And we chose this picture because we wanted to show you what type of process our body is going through and what can accelerate this aging-related process, right? So as we age, our body undergoes senescence. And senescence essentially means that it's a dysfunctional state, which means that the cells are still there, but they're non-functional. They're not as functional as they should be. Now, this is a big topic. We're not going to get into exactly all the factors that lead to senescent cells. We know that it's associated with so many metabolic conditions, cardiovascular, neurodegenerative, and also it's associated with the development of cancer. But essentially, during the aging process, our cells undergo senescence, and senescence associated secretory phenotype. So what you see there as SASP. And this process is accelerated by inflammation and oxidative stress. Therefore, it's called inflammaging, right? Inflammation and aging together, that's the term inflammaging. And the accumulation of senescent cells can trigger inflammation in organs, leading to organ damage over time and an increased risk of these age-related diseases. Now, this process is aggravated by positive feedback loops that drives the accumulation of inflammation, which leads to even more inflammation, right? So damage to our cells leads to inflammation that comes in to clear the damaged cells, right? But if our immune system can't keep up with those damaged cells, or our immune system is not properly functioning, essentially that damaged cells would continuously cause inflammation. That inflammation will increase oxidative stress. That oxidative stress will keep damaging those cells, right? Leading to more senescent cells. And so this is what we call like a loop, right? It's just stuck in this vicious cycle. And that's essentially a big part of what we refer to as the age-related diseases, right? So cardiovascular, neurodegenerative, but also sexual dysfunction, right? As a part of this cycle. And this could also, by the way, impact our skin, right? So with some patients that you see the aging process go much faster, like let's say they're 40 years old, but they look like they're 55 or 60 years old, right? We all met these patients. They look older, right, than their biological age. That has to do a lot with inflammaging, right? And so you can also see here on the top right side that the microbiome plays a role in this inflammaging process. And of course, diet, lifestyle, environmental exposure, the environment that you're in could accelerate or slow down this process of inflammaging. And this is something that, of course, is the core of functional medicine, which is understand these factors that can contribute to inflammaging and contribute to cellular damage, right? Now that we covered this topic, and now you understand the process of inflammaging, we're going to dive deeper into two major factors that also are related to this and can lead to erectile dysfunction. So Dr. Chill, take us into factor number 2.
Number 2 deals with our gut, right? As functional medicine practitioners, one of the biggest areas and body systems that we look into is gut health and the microbiome. And there's a specific reason for that because it has so many influences in the rest of our body, and sexual health is no difference. So let's take a look at how the gut is related to psychogenic factors that we were discussing earlier with our patients who have erectile dysfunction, right? So, ED is closely related to psychological factors such as anxiety, stress, and pressure. And this is a bi-directional relationship. ED can cause anxiety, anxiety can make ED worse. And then the gut and the gut microbiome can actually induce anxiety or even depression. And this is through the gut brain axis. And this can lead to an occurrence of what's called psychological erectile dysfunction. And there is, as I mentioned, a bidirectional communication that exists between the gut and the brain. And this is all facilitated in the nervous system connections, the hormones, and then other biochemical messengers. And then there's an interaction that occurs between this that is really pivotal in regulating our hormones, our moods, emotions, and even cognitive function. So let me just show you a picture to really illustrate this for you. Here, we can see the afferent vagal fibers there in the middle that's going down. These are going to be responsible to diverse stimuli such as mechanoreceptor, the gut peptides, right? We see that on the right-hand side there in the microbiome. And then neurotransmitters, these are going to be responsible for your mood And then even if there's imbalances of neurotransmitters, can cause issues with anxiety or even depression. And then these are all can relay peripheral signals to different various brain regions. And then this can also impact our limbic system. Now, the different vagal fibers projecting from the nucleus attractus solaris, this can regulate intestinal motility and secretion of the pancreatic and adrenal glands and endocrine activity. So now we see that all of these areas can impact each other, right? From the microbiome to the adrenal glands to the pancreas to the endocrine system and then to the vagus nerves. And these are all a part of the gut brain axis, which is really important in the function of overall health, especially sexual health in our patients. And then I want to discuss another impact that the gut has with sexual health for our male patients. And this is going to deal with the microbiome. So let's pop up another picture here for you to take a look at. Now, the microbiome also has to do with our cardiovascular health. So, not only does the gut impact our psychogenic side, right, our psychological factors in sexual health, but the microbiome and gut health can also impact our cardiovascular and our circulatory system. So, with the gut microbiome, it's incredibly metabolically active. The gut bacteria can assist in the breakdown of various nutrients from our diet. It can produce byproducts such as short chain fatty acids, TMAO, which is trimethylene N oxide, secondary bile acids. And then these all have a profound impact on vascular health and circulation. And so in this image, we can see that dysbiosis, which is an imbalance in the gut microbiome, right on the top there, this can actually stream down and promote an oxidation of LDL to ox-LDL. And then thus a gut dysbiosis also contributes to hypertension. And this happens with a vasoconstriction mediated by ox-LDL there that we see on the right-hand side. And then what happens with ox-LDL? Higher levels of ox-LDLs is going to contribute to hypertension. And this is the important part here with sexual function in our male patients. This ox-LDL is going to contribute to hypertension, and this is going to inhibit nitric oxide synthesis. This is really important because nitric oxide is needed for sexual function and proper erectile function, right? And then that can also contribute to endothelin number 1. And nitric oxide is an important vasodilator, and this is produced by L-arginine by NO synthase, which is nitric oxygen synthase. And then ox-LDL may also increase blood pressure by decreasing the production of nitric oxide. Thus, this is going to reduce vasodilation. And then this entire physiological process is very important for proper erectile improper erectile function.
Yeah, that's a really important topic. The gut is such a big topic um, when it comes to addressing the other body system, right? So and we've talked about gut health. I think pretty much in almost every discussion that we had, right?
I think we have, because it's such an important part of our entire functional medicine approach, right? Because it impacts every system.
Yes, exactly. Which is very different than what we learn of in when we go through you go through any healthcare program, medical program. It's typically the gut is typically thought as the organ that breaks down food and absorbs it, right? But here in a functional medicine approach, it's just so interesting to learn how the gut can impact our endocrine system or our blood pressure or our blood flow or inflammation, right? So it's really important for all of us to keep advancing our skills and learn about these pathways And if you see patients with chronic conditions, it's really important for you to learn and know about these pathways, these metabolites, and also learn about the biomarkers, which is how you test, do a more comprehensive testing for your patients. And of course, we have advanced classes in the functional medicine, the clinical functional and nutritional medicine program, which also gets you certified. So there's classes specifically into that. So let's get into factor number 3. So here we're going to talk a little bit more into endocrinology. This is the HPA axis. So the hypothalamic pituitary adrenal, as it's called, the HPA axis, it's a hormonal axis, essentially, that coordinates multiple different, regulates different functions in our body. In the most simplistic way to explain it, the HPA axis is responsible for our fight or flight response, for emotional or physical stress response, also for immune function. And so we're going to take a look at an image, really interesting image that kind of ties what Dr. Chill was talking about when he was talking about the gut-brain axis. And then we'll talk a little bit more about the HPA axis, right? And so in this picture, you can see the exposure to stress can lead to, and we know that exposure to stress leads to stimulation of the hypothalamus, that stimulates the pituitary, that stimulates the adrenals to secrete cortisol, right? Cortisol is our stress hormone, but it's also anti-inflammatory. That's really, really important. And it's a bidirectional connection. There is a connection between the HPA axis and, as part of the neuroendocrine system, and our gut. And this is not, unfortunately, taught in depth in any medical program, but it is important to understand it, because if your patients have imbalance in the gut microbiome, then what essentially would happen is what we call dysbiosis, right? It could increase systemic inflammation. There's multiple ways that it can cause that. It can lead to endotoxemia, lipopolysaccharides that are migrating into the bloodstream, causing an immune reaction. But essentially, if you have systemic inflammation and there are metabolites that are missing, right, or you have lipopolysaccharides that are floating around, triggering an immune reaction, it can lead to HPA axis dysfunction, right? Because that stimulation is really, really important, be bidirectional. And HPA axis dysfunction and elevation in cortisol can suppress the reproductive hormone, the reproductive hormone production. So what will happen is you'll see a shift in testosterone levels, you'll see a shift in neurotransmitter levels, which are all important for having proper sexual function. This, by the way, will not only be a mechanism that applies to men, but also for women, right? And so the imbalance in hormones and neurotransmitters could lead to a reduction in the desire to even have an intercourse, right? And so there's two things that, and we haven't dived into this because we talked about some big topics today, but we always want to ask our patients about what's their level of sexual desire, right? That also tells us something about the endocrine system, their stress response, right? Which is the HPA axis. Physiologically, that's the HPA axis. Sometimes we'll need to involve a life coach that will help them to manage their stress. Sometimes we'll have to involve a marriage counsel. Sometimes we'll have to involve mental health counseling, right? But physiologically, which is what we do here with the functional medicine approach, that stress would be the HPA axis, that inability to have sexual function, to have proper sexual function because of stress, that sometimes is related to the HPA axis. So this is one example on how if you have the wrong type of bacteria, not enough beneficial bacteria, then that's an imbalance that could lead to systemic issues with communication, right? Both endocrine in terms of hormones and neurotransmitters in terms of the neurological function. And there's another really interesting study, and you can read more about this if you want to. This was published in the Journal of Molecular Psychiatry in 2016. It's called From Gut Dysbiosis to Altered Brain Function and Mental Illness, Mechanism and Pathways. But there's another really interesting study that I wanted to mention, which talks a little bit more in detail goes into the type of bacteria. Because what we teach a lot in our advanced and clinical functional medicine program, we put a lot of focus on understanding the pathways, but now let's focus on how do we test this? How do we understand if the patient does have a certain dysbiosis, they're missing certain bacteria that are beneficial or essential for healthy function, and what are the types of interventions? So this particular study showed us that there is an association between some bacteria and erectile dysfunction. For example, if there's an increase of abundance of a family of species of bacteria that is called Lachnospiraceae, it could result it is associated with elevated risk for erectile dysfunction. Now, if you have, on the other hand, an increase of abundance of a different type of bacteria, such as Ruminococcal, then that is associated with a decreased risk of erectile dysfunction. So essentially, what's the takeaway from this picture and all the fancy names of those different bacterial species is that if you have or your patient have the wrong type of bacteria composition in your gut, it could lead to different chronic conditions. The only way to know, again, we learn about the signs and symptoms. We learn about specifically what we need to look up for, right? We learn about what's influencing it in terms of lifestyle factors, dietary factors, some supplements or probiotics that can specifically impact these pathways. But we have to test, because if we're not testing, we're guessing, right? So this is where going into a more comprehensive testing, and we teach you specifically about the biomarkers and the treatment protocol for each one of them, is really, really helpful. So far, just as a summary for our functional medicine section here, we've talked about 3 major factors. We talked about the gut-brain axis. We talked about chronic systemic inflammation, right? We talked about the HPA axis as part of the more neuroendocrine part of this whole of this root cause approach. The question is, as always, is what's driving that dysfunction, right? That's where we really help our patients on a much more comprehensive level. And it's important to know it because erectile dysfunction, as we mentioned, is much more common disorder than we think of, because a lot of patients just don't report it, right? And there's a lot of money that is spent on those conditions. Some patients spend thousands of dollars every year on pills, on pumps, on rings, on different devices, on injections that are painful, right? They spend a lot of money, and most of it is non-covered by insurance. It's out of pocket. Also, large corporations or systems are spending a lot of money on this problem. For example, there was a report that was published in the Military Times, the Journal of Military Times. And they pulled data from the Defense Health Agency, which is military, Pentagon. There's like all these different branches of government, defense forces. And they found that in 2014, the US Department of Defense spent over $41 million just on Viagra. And in total, they spent $84 million on drugs for erectile dysfunction. right? And we know that those drugs are very, very temporary. They have to keep taking them. Some patients get desensitized to them, right? So, and they don't solve the root cause, which is why if you learn how to treat this problem, your practice is going to be busy, right? And I had a colleague as I was going through the training, one of the initial functional medicine trainings, who was doing a big part of his practice was erectile dysfunction. And those patients, they're quite motivated, right? They're quite motivated, and and these treatments are hundreds of dollars for per session. So our hope is that you will offer your patients a more comprehensive approach rather than just a band-aid, because in the long term, it will save them a lot of money. It will save them thousands of dollars if we're able to improve their health and help them to improve their sexual function. And then they don't have to rely on these injections and pills and rings and mechanical pumps, or even going into an implantation surgery, right? Which is $15,000 to $25,000. So far we talked about these root causes. Make sure you dive into our platform, our functional medicine platform, to learn more about those. And this is a great time to talk about some quick wins for your patients. And so let's talk about a few supplements that your patients can utilize for improving their sexual function.
Yeah, so here are a few supplement considerations or even treatment considerations for your patients. Now, when we're discussing all of these treatments, we're not saying that they should be taking all of these treatments, right? What you should do is use these as considerations, and what you want to do is actually personalize these treatments. So, for example, here, the first one is short chain fatty acids. So these are going to be for patients that have erectile dysfunction due to circulatory issues, right? So you want to do an assessment with them and figure out what their underlying factors are. For short chain fatty acids, this can help with circulation, and this can help with reducing ox LDL. So if your patients have higher levels of LDL, and they also have cardiovascular issues, short chain fatty acids can actually help with improving their erectile dysfunction through improving their cardiovascular health. Because the short chain fatty acids, it serves a wide array of functions, right? It's going to help with our intestinal epithelial cells, which we were talking about earlier, that the gut health can also be responsible for cardiovascular health. So maybe the root issue of their circulation and their ox LDL was an imbalance in their microbiome. Well, short chain fatty acids can help them. And if they have erectile dysfunction on top of that, well, short chain fatty acids can help with that. But you really want to look at what their specific underlying cause is before you give them a specific treatment consideration, right? You don't want to just throw all of these at them. You really want to individualize all of these treatment approaches and pick the best ones that are specific for their indication.
Yes, absolutely. So that's a great recommendation. Short chain fatty acid. Of course, it's a good recommendation, but it is temporary, because our gut, under healthy conditions, if you have the sufficient amount of healthy gut microbiome, the beneficial bacteria, your body will produce the proper amount of short chain fatty acid 24/7, right? That's how our gut works for us, right? And that's why it's so important. This is why me and Dr. Chill have been talking about gut the entire time, because it's such an important part. So let's talk about another really good supplement that could help, and that is L-arginine. So L-arginine is the amino acid that is a precursor for nitric oxide, and we know nitric oxide is really important for stimulating or bringing in the blood, increasing the blood flow into the penis, and supporting, allowing that erection to happen. It's an amino acid that is found in many protein-rich foods such as animal protein, soy, some whole grains, beans, and dairy products. For patients that are consuming foods that are higher in L-arginine, it could support blood pressure, improve blood flow, and support sexual function. There was a really interesting randomized control trial that had 540 patients with erectile dysfunction, and they tested to see what is the effectiveness of using L-arginine as a supplement with a dosage of between 1,500 milligrams to 5,000 milligrams. And they found that there was a significant improvement with all dosages when they compared it to placebo or no treatment at all. So we're going to post it here, the dosage, so you can take a look at that. And here's the study. If you want to read about it, it's called The Potential Role of Arginine Supplement on Erectile Dysfunction in the Journal of Sexual Medicine. And again, just as a quick recap, the dosage ranges between 1,500 to 5,000 milligram. Typically, we recommend always to start at the lower dosages. And this might not be appropriate for patients with cardiovascular conditions. It could have some interaction with medications in high dosages. So always start in a slower dose and see how the patient, monitor the patients to see how they respond. So far we had a short chain fatty acid is number one. The second is an amino acid called L-arginine. And then Dr. Chill, what's the third option that is more of a herbal approach?
Yeah, so this herb is great. It's called epimedium, and this is also called horny goat weed. And there's a specific bioactive compound in epimedium that is responsible for helping with erectile dysfunction. It's called icarin. And what does icarin do? It actually has been shown to help with not only cardiovascular health, but also reproductive function, bone protection, neuroprotection, and increasing testosterone levels. So this could be good for your patients that might have neurological symptoms or neuropsychological impacts for their erectile dysfunction. They might have cardiovascular issues that is impacting their erectile function, or they might have low testosterone levels. What epimedium does, it has been shown to boost testosterone. And what they did, there was a study that was completed, and there was actually many studies that were completed, and it noted in a rat study that a dosage of 200 milligrams per kilogram of extract that was shown to increase testosterone levels. Now, what we want to do is convert that into how the human dose should be, right? So let's kind of show you what that should be. When you are looking at supplements that contain epimedium, you want to look for about 900 milligrams if you're about 150 pounds, 1,200 milligrams if you're about 200 pounds, and then 1,500 milligrams if you're at about 250 pounds. And then in anything in between those aspects for your patients. But I use epimedium with my patients, and it works really well with erectile dysfunction, along with addressing all of their underlying causes.
Yes, and it's really interesting that we've recommended before to patients the epimedium, and there's a interesting, of course, the name that some people might recognize it is the horny goat weed.
Right.
And there's a really interesting, according to this has been used, by the way, in the traditional or Chinese medicine for thousands of years. They're old, ancient books that talk about these herbs for literally centuries and a few thousands of years for boosting the sex drive. And the name horny goatweed, according to the story in Chinese, it's called yin yang ho. So yin yang ho, hua, yin yang hua. So, and which is literally translate into promiscuous goat plant. And it, according to the story, it was a Chinese goat herder who noticed that his goats becoming more sexually active after eating the plant, the leaves of this plant. So it's really interesting to mention. That's why it was called horny goat weed for centuries. But it also interesting to mention that the mechanisms of horny goatweed is very similar to Viagra. It is an inhibitor of phosphodiesterase 5. So it's essentially the same mechanism as the pharmaceutical drug as Viagra. It's just not as concentrated as what you will get with Viagra, but essentially what it does, it enhances the smooth muscle relaxation and blood flow into the penis. And it might also increase the activity of nitric oxide synthesis enzymes, and elevate, also increase the production of nitric oxide. So it's got different mechanisms. You definitely don't want to mix that with Viagra or other medications because of that potential interaction. They're both doing the same exact thing. And then, as Dr. Chill mentioned, I've seen the recommendation is from 900 milligrams to 1500 milligrams of epimedium. I've seen some good positive results with patients starting from 300 milligrams of epimedium. And what we'll typically tell patients, this is going to be different than Viagra. While some patients might see a real benefit by just taking it, and I had patients that kind of were just taking it before a few hours before they want to have sexual interaction. I would typically, in the initial phase, would typically recommend patients to take it every day, 300 milligrams to 600 milligrams every day. In the morning, 300 milligrams, in the afternoon, 300 milligrams, especially if they got lower testosterone, especially if they got chronic fatigue, because it's a very strong adaptogenic. And I'm sure, Dr. Chill, you've recommended this. It's a very common herb. When you're doing herbal medicine, it's one of the common herbs that we'll sometimes use for men's health, right?
Absolutely. And actually, that is the best approach, is to do it maybe even a couple of weeks to like a month before you start to really see the impacts of it. I mean, I've had patients where they've seen the impacts of it right away, right before their sexual activity. But if you are using herbal medicine, you want to start with making sure that you're starting to consume it, right? So it starts to have an impact on your body systems. And then when you take it proactively like that, and then right before your sexual activity, it's going to be that much more effective for you.
Yes, absolutely. So, general recommendation to consider with your patient is you can have them like what I used to do is have them on 300 to 600 milligrams every day for 3 months, and then they can take a little extra before they want to have a sexual intercourse. And with some patients, you can even just have them take it before, just take it instead of taking it every day, just take it before they want to have intercourse. That's okay too. But always remember that we always want to continuously look at the root causes, because we also seen a lot of patients that have other issues that driving this dysfunction, right? So both me and Dr. Chill gave you today, we talked about 3 major root causes. There are other root causes that we have to look into. We dive more into it in Dr. Caviola's has a special class on men's health where he dives into all of these additional issues and some of the labs, and he shows you some case studies, really interesting in kind of putting it all together. But you also now learned about the short chain fatty acid supplement, the L-arginine, and the epimedium, the horny goatweed. So now you have some really good strategies to consider with your patients. We added the citations for their research so you can read more about it. As usual, we encourage you to log into the Advanced and Clinical Functional Medicine program to learn more about this, learn more about the biomarkers, the labs, how you can offer more comprehensive care. And Dr. Chill has been doing one-on-one coaching with so many of our community members, with physicians, nurse practitioners, PAs, and he's doing case studies. So if you get a patient struggling with something chronic, you're invited to do a coaching call. All our community members in the Advanced Functional Medicine program have that available to you. So you don't want to be out there by yourself trying to figure out things. How do I work with those specialty labs, or how do I grow my practice? How do I open up, private virtual consultation practice? Like, we're here to help you. That's where we're here. That's where we meet up together. And you feel free to reach out, schedule a coaching call with Dr. Chill, and start offering this unique approach to your patients. We encourage all of you to connect with us, and let's help you to grow your practice. It's just a blessing. It's a blessing for you. It's a blessing for your patients. This was, I feel like, Dr. Chill, we covered a lot in just about 1 hour.
We did, and this was some really good information for the underlying causes that not a lot of people understand, right? That we can really address in using the functional medicine approach. And now they have some treatment strategies along with that.
Absolutely. We always get that sneaky question. We always get that question kind of sneaking in like 3 or 4 or 5 months into it, once the patient saw that what we're doing is so beneficial, they're feeling better, their symptoms reduce. And now the sneaky question comes in: can it help? Can it also help with this, right? And so it's not talked about a lot, unfortunately. This is also one of the reasons why we introduced those 16 specialty classes that are not taught in other school by experts like Dr. Boyce, who's going to teach all of you specifically for women's health condition, or Dr. Caviola, specific males conditions or geriatric conditions, right? Or other physicians are experts that are going to teach you about specialty neurological disorders or chronic pain or metabolic. So this is why we're here. We're here to dive deeper, offer more comprehensive care, and yeah, it was an awesome discussion. And as usual, I want to thank Dr. Chill for being here, for putting it together for us, for sharing his years of experience with us. And I also want to thank our media team and Jacob, who put us all together and allow us to connect with you wherever you are. And I want to thank all of you for everything you're doing for your patients, for your dedication to improving your clinical skills, to bring a more comprehensive approach to these patients who are struggling. They spend thousands, hundreds and thousands of dollars on their health concerns, right? And bring in something beyond just a band-aid approach, right? Bring in an approach that actually helps them to improve their health, right? So I want to thank all of you for everything that you're doing, and take care of yourself, and we'll see you next time.